median rhomboid glossitis. So median rhomboid glossitis, it is also called as central papillary atrophy of the tongue. Central papillary atrophy of the tongue. So it is a developmental defect and it is due to the incomplete descent of tuberculum impar and entrapment of a portion between the fusing lateral half of the tongue. So it is due to the failure of fusion of tuberculum impar. So it is a benign lesion of the tongue and characterized by rhomboid or oval in shape, and changes occur in the tongue mucosa in the midline just anterior to the foramen cecum. So in pathogenesis, it is due to the failure of tuberculum impar. So it is a congenital abnormality of the tongue which is due to the failure of tuberculum impar to retract or withdraw before fusion of the lateral half of the tongue, so that a structure divide of papilla is interposed between it. So the etiology, the first one is developmental. The persistent tuberculum impar suggested its developmental region. So in developmental, the reason is persistent tuberculum impar, and the cause for fungal infection, it is due to the Candida albicans, in many times found in this lesion. So if it affected by the Candida albicans, it is called as posterior midline atrophy candidiasis. And the third one is etiology is metabolic. Median rhomboid glossitis is more common in the diabetic patient than the non-diabetic subjects. And the next feature is clinical feature. First, age is almost 15 to 80 years. It affects all the age groups. Sex, male's predilection, and site, it is located just anterior to the foramen cecum on the dorsal surface of the tongue, in the midline and anterior to the circumvallate papilla, and anterior to the foramen cecum and anterior to the circumvallate papilla. Symptoms, generally it produces no symptoms, that is asymptomatic, but pain and ulceration are also present. Rest of the tongue may be coated or matted. And the appearance of the median rhomboid glossitis as ovoid, diamond or rhomboidal shaped reddish patch or plaque present on the central portion of the dorsum portion of the tongue. So in some cases, flat or slightly raised area stands out from rest of the tongue because it has no filiform papilla. So the surface is dusky red and completely devoid of filiform papilla. So in median rhomboid glossitis, there is completely devoid of filiform papilla and it is usually smooth. So this picture showing the median rhomboid glossitis presenting on the dorsum surface of the tongue in the central portion. So, and the important point is, it is also known as kissing lesion because in the soft palate it produces erythema. When the median rhomboid glossitis that touch the palate, it produces the soft palate erythema. So it is called kissing lesion. So the diagnosis, clinical diagnosis, it presents as a rhomboidal shaped lesion and present on the posterior part of the tongue. And the next diagnosis, laboratory diagnosis, the biopsy shows loss of papilla with varying degree of hyperkeratosis and proliferation of spinous layer with elongation of retipex, and it may branch and anastomose. So diagnosis is main is clinical diagnosis. There is a definite rhomboidal shaped lesion on the posterior part of the tongue. And the management, there is no absolute treatment for this condition. If there is presence of candidal organism, then go for antifungal agents. Otherwise, no treatment is needed for this condition.